now we'll hear from Dr. Bernardine Lacey.
Good afternoon, and I want to take this opportunity to thank the Academy for bringing to us this critical conversation that I hope won't end with today. I'd like to make a statement first to say that pity and compassion in a world of pain mean nothing unless it leads to change. I want to relate to you today my own experience with racism. Think about a young woman, about 20 years old, who wanted badly to be a nurse. I am a native of Vicksburg, Mississippi, and I was admitted to nursing school in the late 50s at a school at Mississippi Baptist Hospital in Jackson, Mississippi, which is 40 miles from my home. At that time, of course, as all of you know, there was deep segregation. The class in which I was admitted, the program was described as a dual program. But the definition of dual at that time meant that they admitted both white students and colored students. At that time, we were colored. In my class, there were 64 white students who were seated in rows up front, and there was an imaginary line, and the 6 colored students sat in the back. At that time, I was addressed as Nurse Mays. The white students were addressed as Miss Smith or Miss Jones. Even though my experiences were at Mississippi Baptist Hospital, I could not enter the hospital through the front door. I could not eat in the cafeteria with my classmates. I ate in the kitchen with the kitchen help. At that time, this is all I knew of how people were treated. So understand me, that even though it may have been painful, I didn't know any other way. During that time, the hospital was designed so that there was an annex for colored patients called the Green Annex. But during my experience as a student, we were never assigned to treat or care for patients on the Green Annex. Primarily, now I understand, it was because they did not wish the white students, young ladies, to be exposed to colored patients, nor particularly colored men. So the only opportunity I had to provide services to the colored patients was we were given 2 days off a week, and one of those days I could work. So I always elected to work on the Green Annex and care for those patients. When I graduated from Mississippi Baptist Hospital, I took a job at Tuskegee, Alabama, and during that time my mother took sick. So I came home to care for my mother. As she improved in health, I said, well, maybe I'll try to get a job in Vicksburg. There were no colored registered nurses in my town. The physician taking care of my mother was a white physician, and I spoke with him, and I said, can you assist me in finding a job at the county hospital, which was located in my town? And he said, well, I'll go to the board of directors and see if they would be willing to employ you. And he did, and they employed me. The position that was available was as evening supervisor. So 6 of the white nurses resigned from the hospital because they hired me. The rumor around town became that I was coming there to integrate the hospital. That wasn't my reason at all. I was coming because I needed to work and I needed a job. So several months after receiving, after a while, a number of threats, one evening the hospital was divided into two sections. One section was for the acute care patients and the other section was for chronic patients, and there was a catwalk. And as I was crossing the catwalk one evening, someone took a shot at me. The police came and they said, well, we'll have to take you home. We'll take you home. They took me home, and when I got home, my mother had heard the news. She was packing my bag. She said, you've got to get out of town. They will kill you. So that began my journey from Mississippi to Washington, D.C. Now, I know that some of you are sitting there and say, well, that was then, but this is now. But you heard that this is cyclical. And if any of you have had any time to listen to CNN or MSNBC, it's now. It's not then, it's now. When I read and heard about Charlottesville, that brought back some terrible memories for me. Terrible. I say, it's not gone. It just presents itself in different ways, but it's not gone. It's not gone because right here in Washington, D.C. today, 6 weeks ago, about 6 weeks, one of the major hospitals providing services to African American patients in particular closed its obstetrics unit. About 2 weeks ago, another major hospital in Washington closed its obstetrics unit. Now, in speaking with the people in charge of health, they said, oh, there are plenty of OB beds in Washington. Yes, I said, there are plenty of beds. But tell me how those women in wards 7 and 8 are going to get to where those beds are located, which is in the central part of Washington, many of them not particularly happy to have those clients. Tell me how those women will have transportation and access to getting to OB services. Tell me how the next hospital that has closed, how those women, that population where that hospital is situated is primarily Hispanic. And many of the OB services, physicians providing services or others providing service, don't accept Medicaid. So we've got a problem. Things about talking about access and the social determinants, that has a lot of, that will present to us a lot of things to think about. Access is one of those particular things in talking about providing services. You heard Mr. Smith when he's saying how important safe births are. What's going to happen to these women? And what's going to happen to these children who will begin life, not quality life at all? What's going to happen to them? So this morning, I got a telephone call from a physician friend of mine who knows, that I'm a social activist. And he called and said, you're going to be happy to hear this. So when you give your talk today, you tell those nurses how brave they are, because the persons now standing up to what has happened in Washington, he told me, are the nurses. So I'm so pleased and grateful to hear that it's nurses who are coming out front and presenting to the health commissioner. You don't have any plan. What plan do you have for these women? So the nurseries, of course, not only did the OB unit close, but it meant the nurseries closed. So it's not over. Cyclical, yes. It's coming back in different ways, not coming back, but it's continuing in different ways. So I had to tell you this story today because it's still painful for me. It's still painful for me to know that it seems that I'm going to live this thing over again. The climate in this country is not good. It's toxic. The climate in our country is toxic. So I want to end with saying something to you, because I told you nurses are standing up in the district. But change will not come if we wait for some other person or some other time. We are the ones we have been waiting for. We are the change that we seek. These words were spoken by our former president, Barack Obama.